It's easy for us to think the key to health lies in pills or expensive procedures. Give me something to make me lose weight. However, the safest, most permanent, and least expensive prescription is available to all and is as simple as lacing a pair of sneakers. Traveling the pathway to health. The doctors are on call tonight.
After midnight, searching for you.
Funding for On Call is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, Regional Health, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
Hello and welcome to On Call Television. Well, if you ask anyone, and they'll tell you that this year or last year their New Year's resolution was either to eat less or to exercise more. When asked about exercise, my patients invariably tell me, well, I could do better. Most every pastor or priest will tell you that good intentions are worth nothing unless they're put into action. So it is with our intention to do more exercise. And yet, because of all the modern conveniences, most of us do not get enough. In fact, a new CDC study shows that Americans are simply out of shape. Fewer than 2 in 10 get the recommended amount, and more than a quarter of U.S. adults do not get any physical activity at all, 25%. Not even light activities such as golfing or gardening. Although we do better in this part of the country than most, we still could do so much better. Recent studies have shown that the biggest predictor for Alzheimer's is a lack of exercise through your midlife years. We know also that the opposite is true, that the best way to prevent memory loss is a lifetime of physical conditioning. New studies have also shown that one of the biggest predictors for death in older adults is the ability to get down or up from the floor. Exercise has been shown to reduce breast and colon cancer and is also the primary and underemphasized treatment for diabetes, balance problems, falling risks, and the list goes on. Well, tonight's show is all about exercise, and to help us with this topic, we have two big-time exercisers. Dr. Karla Murphy is a pathologist from Avera McKinnon Hospital and Physicians Laboratory. Originally from Brookings, her mother a nurse, her father a PhD plant science researcher and biochemist, she came from a family tradition of science, and she's paying it forward as her daughter, also an MD, is soon to finish her residency in general surgery. She received her undergraduate degree in St. Catherine's University in Minnesota, medical school at USD School of Medicine, and pathology residency at Sanford USD in Sioux Falls. She is a past president of the South Dakota State Medical Association, and she's a regular exerciser. Matt Bean is a physician med-ped specialist practicing half-time at the Avera Medical Group Brookings and half-time at Sanford USD School of Medicine teaching medical students. Originally from near Veblen in Britain up in the northeast corner of our state, he was raised on a ranch as his mom and dad had to have a calf-cow operation. Matt's mom is a retired elementary school teacher. His kids are not out of high school yet. He received his undergraduate degree in Augustana in Sioux Falls, medical school at the USD School of Medicine, and med-peds residency at Marshfield, Wisconsin. Presently, Matt spends a lot of time in the Office of Medical Education designing curriculum and teaching medical students as a clinical associate professor at Sanford USD School of Medicine. His expertise for tonight's topic comes from his being a long-term exerciser, even the race director of the Brookings Marathon. And I've already signed up for the half this year, and I know that it's filling up.
It's getting close, very close.
It's amazing, the half marathon and the marathon that's doing in Brookings. And before we do any more about this, let's talk about the marathon and half marathon in Brookings, Matt. Now, would those of the watchers out there who haven't run a marathon, this is a good one.
Definitely is. Boy, you just don't want to jump into exercise with a marathon. So we have all sorts of distances up to that point. You know, there's the 5K the night before.
5K is about
3 miles. And the next day you could be part of a relay and run anywhere from 4 up to 6 miles. And then there is the half marathon and the marathon that day. So 2 months out, that's May 10th of this year.
And how close are we to filling up?
Boy, the half marathon is going to be there within a couple weeks, I think.
Oh, really?
Marathon, we're shooting for our full 300 by the time race day hits, and I think our marathon teams will probably fill early to mid-April.
Wow. So that's great. Well, it's a great, it is a celebration of health. And I try to run that half marathon every year, and it's getting harder. But but you have to stay in shape to be able to get there. And a half marathon is 13.1 miles, so that's a lot. It hurts a little bit, but it's doable. The full marathon, 26.2, that hurts a lot. I've done one. So, Karla, have you run any marathons?
I am not a runner, and I admire both of you being runners and organizing runners. My exercise is more of a walking pace,
Okay.
or I exercise making use of the water in a fitness center that I belong to. So those are sort of my favorite ways to walk the dog or get in the pool with some good friends.
So how do you know that I knew to ask you to be on this show?
I think that some other frequent exercisers from my particular gym might have mentioned it to you.
Yes, that's exactly what happened. I called the State Medical Association director and said, I need a doctor who's a regular exerciser. I mean, somebody, who's religious about this. Karla Murphy, she said. So you can blame Barb Smith on that one.
I will do that.
You can blame her. But the truth of the matter is you are a regular exerciser for how many years?
Oh, I suppose it's been 11 or 12 years.
12 years.
Children, kind of come and interrupt that plan, but as far as making the effort every morning to go to the gym, except for Saturday and Sunday most years.
So five
there.
days a week, 45 minutes?
Yeah, something like that.
And a variety
to
of
an hour and a half. Exactly. And the benefit of that has been not only the exercise, but the really strong long-term friendships that I've made with people that I would not have known. And those are the people that, if I'm not there tomorrow morning, they'll be on the phone and they'll be saying, where are you? Do you have a good excuse? So,
yeah.
so in addition to the exercise, I get a lot of my social needs from meeting up with other people to exercise.
Yeah. What about gyms?
What about the gyms as far as getting you out there? The couple things we talked about so far is just that it can be anything. It's really something you enjoy doing. It doesn't have to be running to be exercise. It doesn't have to be walking. It can be skiing. It can be swimming. It can be anything. So it's nice that gyms are just one of many opportunities. It's nice and structured for some people who like that structure. The other thing you mentioned is the accountability. I think you do meet people there, and you have that person that, if you're not there the next day, they're going to remind you, and you feel like, boy, I have to get out of bed when I don't really want to in the morning because I know there's someone there waiting for me.
What is your exercise program? Because I know you are full with the School of Medicine and the medical, the clinic as well. You're burning the candle on both ends. How can you find time to exercise? Do you?
I think it's just been a part of my life for so long. It's part of my day. I feel so much better when I exercise, and for me it's running. I just enjoy running, and I'll run as long as I can run, and then I'll just walk after that, I'm imagining. But
do you run in the mornings or in the evenings?
as I've gotten older, I think the later in the day seems like it's a little more comfortable, but I'll go either side of the day if I can.
Yeah. And I have to tell you my experiences, so I'll join you with this. I'm a three time a week pretty aggressive runner. So Wednesday afternoons I'll try to get there and I'll run 4 to 7 miles if I can. And then Saturday and Sunday, both those days, I'll try to do somewhere in there, and when I'm getting to the half marathon, I'll try to get those 6, 7, 8, 9 mile once a week or every other week kind of a thing into the marathon. But somebody came up to me, Lynn Thompson, who was a nurse at the hospital, and she said, Dr. Holm, she said, I think you could belong to our Doing It Daily club. And I said, well, what's that? She says that you exercise 6 days a week. You get 1 day off. And you put in $20 and you do it every single day. And I said, look, I'm really good. I mean, I'm 3 days a week. I hardly miss it, maybe 2 days a week at the max when I'm really busy. She said, you're missing out. You could figure a way to get a mile in, just a mile, the other days. So I found that walking to the restaurant where I do my reading and studying and writing every morning is a mile. Half a mile there, half a mile back. So I walk Monday through Friday to Cook's Kitchen in Brookings, and then work out on Monday or on Wednesday, Sunday, and Saturday. And so I do it every day.
Well, that's a great way. That's a great way to really incorporate it into your day, and it's something that you're going to do every week.
It's just that walk that's so amazingly beneficial. I didn't realize it until I started doing that walk. It just changed everything.
And you built it into your day. I think that's key. I mean, it wasn't added on to the many things you have to do. You just sort of built it into the things you're doing.
So what do you do when the weather is really bad?
Right.
It's not the snow, but ice. What do you have a substitute?
I want you to know that this Sunday was the worst crappy, horrible run outside day you could possibly have had. I went to the wellness center, paid my $6 or whatever it was to do it, and I ran around the track and I did, that kind of a thing. All through the week, all through this winter, Monday through Friday, with rare exceptions, I just I put on those rubber boots, that you can pull on over your wing tips, and you clamp the side thing, and I don't even take them off when I get to Cook's. I just wear them. Keeps your feet warm, and I have a parka and a hat, and I buckle up, and I listen to the radio on the way down, or I think about what I'm going to be writing. And so I just build it into my day. I don't care what, when the roads are I can still walk there as long as Cook's Kitchen is open. Every once in a while they can't make it, but I'm there. So I think it's a religion. As you've said to me personally, this getting into a habit is very important.
Right.
That's one of the things I tell my patients is, if you're trying to find time for exercise, it's going to be tough. You really have to make time in your day, and either build it in or make it a priority such that other things are going to fall farther down on the list. And once it gets into your daily routine, it gets to be a habit. A few weeks into it, all of a sudden, you start missing it.
I think so. And I think that the other part of it is one could look at their day and see where they are moving. I mean, their heavy housework is exercise. Mm-hmm. Walking the dog is exercise. Dancing with the grandchildren is exercise.
Or with the husband or wife. You can
exactly.
go dancing. Gosh, a lot of older people dance.
That's right. So, those things all count. And you're doing that already. So it makes it easier. You're not starting from zero. You're already exercising.
Right.
Taking the stairs.
You're right. I think that one of the messages that Lynn Thompson taught me was that if you can just make it 20 minutes, that's all we're asking for you to stay. If you do 20 minutes of something, you're still in the pool. You don't. If you can get your $20 at the end of the year if you've still been doing 20 minutes of something that makes you breathe a little heavier, mm-hmm. and maybe that's biking. Maybe it's just a mile of biking, but walking a mile is a goal. 12 blocks is a mile. If you can just walk 6 blocks away from home and back, you've done a mile. That's enough. That's enough for the majority. You know, what we can talk about after we get back from this break is the question of how much is enough and what ages and how should you start, if particularly if you're disabled or older. Or, so let's come back to that. Well, the best exercise habits start early in life, and at the Brookings Boys and Girls Club, they have a program directed towards young girls to get them into a lifelong exercise experience.
We started this program because we have 3 priority outcomes at the club. So we have academic success, character and leadership, and healthy lifestyles. Girls Hour falls under healthy lifestyles, and what we saw over the last couple of years is the boys are more prominent in the gym, and we really wanted to get our girls members in the gym and being active, and so we dedicated a whole hour to Girls Hour.
Because it's really fun and something that we can do in the gym because usually boys just come in here.
It's pretty easy to get the girls in the gym during Girls Hour. They really like that it's just the girls and not the boys. And so once we call it over the loudspeaker, we really get about 50 girls in there at a time.
Because it's fun and we're not always with the boys. There's no boys around and it's Girls Hour, so you can hang out with me and your friends will be here.
We have seen a change in the girls that they feel more comfortable in the gym. And so now we see that when other programs are being run, such as dodgeball or different programs, the girls are more apt to go into the gym because they've gotten comfortable through Girls Hour.
Reverse, set, go!
Because it gets you energetic and not lazy, so you don't just sit down and watch TV, like not TV, just sit down on the couch out there in the social rec. There's Girls Hour, so you can come in here, have fun. So you can stay active and energetic and stuff, like running and soccer. I love soccer.
We actually have a boys' hour in the art room at the same time that Girls' hour in the gym is going on. Boys are the minority in the art room and girls are the minority in the gym, and so we offer specific hours for them each in those different spaces. We have an average daily attendance of about 320 youth a day, and we get about 50 girls in the gym, which is pretty good because we have an art room, we have an education room, and we have a social rec space. So we see a lot of the attendance during Girls Hour be in the gym.
Because it's really fun and you can do a lot of stuff.
Through Girls Hour, we have seen changes throughout their behavior. They're more confident in themselves. They feel more comfortable in the other spaces of the club. They do understand, that they're welcome in all spaces, and they feel good going into the gym now. And so I think it's just helped with teamwork among girls, and really getting along with their peers, and that translates to other places in the club.
Well, you can just be with other girlfriends of yours. Don't be nervous, it's just girls coming in here and it's going to be a lot of fun. Hang out and have fun.
That's very interesting about what they're doing with little girls. I mean, so what's your take on that? How important is this kind of work?
Well, I think it's where you start the habit is when you're a child. And somehow these kids now need to have things to do. It's not the same place that we're growing up in. It's not easy. I mean, you can't just let your child walk to school or their piano lesson.
They don't do it anymore.
So those exercise options are gone.
There was a guy visiting. We had a German exchange student who came to our high school, and he got to the high school and there's this big parking lot and there's no bikes. And he went, "Oh my gosh, this is really different than Germany." I mean, there's a change going on in our country. And it's not been a good thing, I don't think.
Yeah, I agree. I think there's just fewer and fewer opportunities for kids to do that unstructured play time that just burns calories and gets them out the door.
Would you blame the video games?
I think it's a combination of things. I think it's just a change in our comfort with the safety of our neighborhoods. I think it's a change with opportunities that are available. I think it's more video games and just growing up in a culture that maybe is emphasizing exercise a little bit less.
Yeah. So how should we change that? I mean, what should we as a society do different? I mean, how can we make it different? I know we're trying to do bike trails to school and a variety of different things in Brookings, but I don't know how successful it will be. And I mean, can we change that?
I think programs like at the Boys and Girls Club, like Karla said, I think you need to build it into their habits at a young age, and if it can't be modeled at home, we have to try to supplement that with other places.
There's been an argument about the way we do athletics in school, because it doesn't include but just 5 players in basketball. You look at the stands, there's tons of kids in the stands not playing. Soccer's a little bit different. How could we do different? Should we emphasize things differently in our schools?
You know, I think in my son's school, they're looking at more lifestyle sports. He'll take high school gym this summer, and they'll go fishing. They'll walk. So those sorts of, substituting badminton for some of these more usable lifelong skills is important. I think that there are lots of programs that exist for those competitive sports, at least for the younger kids. You mentioned soccer, basketball programs where there are options through other clubs. And
yeah.
Exactly.
Right.
Exactly. All very important.
Matt, you're a pediatrician. I mean, what do you think about physical activity in kids? And
I approach it sometimes a little differently with parents, and you mentioned screen time, video games, television, that type of thing. So I try to tell parents, can you shoot for less than 2 hours a day?
Of TV.
Or I talk to the child themselves, and I say, Mom's going to help you or Dad's going to help you count the hours, and we may put a timer on things, and if you get close to that 2 hours, they're going to maybe have you get out the door and go biking or play tag or do something else that's not involving the screen. And I think if you can limit screen time, they're bound to do something that's more active.
Well, how often do you what's on? I mean, turn it off. That's what, if there isn't that favorite program on, turn it off and get out and be a little bit more active. Well, we've talked about the advantages of exercise habits for kids. What about adults, older people who have hard time with mobility even? How do we, and probably more of the audience listening are going to be wondering about this. I can't do it. I've got too bad of arthritis.
Well, it can go both ways. I think you really have to start slow. If you haven't been doing anything, there's no question you have to do the simple things first, and maybe it's just walking for 5 to 10 minutes, and the next week it may be up to 10 or 15 minutes, and work your way in. You'll be surprised that over time, just doing something physically active creates more muscle that kind of supports your joints, and you can, with time, actually, even with arthritis, find that exercise actually helps.
There's a huge study about arthritis. Does resting it make it better? Osteoarthritis, the plain classic degenerative joint disease. Does resting it make it better? Do they do better if they're pushed to exercise? Will you hurt the joints by exercising?
Yeah, that's another kind of difficult one. I think, again, with time, supporting those joints that are a little bit damaged is actually better, so if they can get into exercise. Now, it may take some exercise that's not as hard on the joints to start with, at least, and that's swimming or exercising like aerobics in the water. Maybe it's biking, something that offloads the joints and yet gives you something physically active to do.
Yeah, Karla.
I guess I would have to agree. I think that in my water exercise is aerobics, either in the shallow water or the deep water, and there is a wide variety of people who are able to do that exercise. They may not be swimmers, and if they're not comfortable in water in the shallow, they're not too deep. I think that really gives some options. I was going to ask you, Matt, about who needs to have a medical evaluation before they start a program?
Yeah.
But I think that's maybe a good discussion. You could chime in too, Rick, but I think probably if you're over age 50, certainly if you have some diagnosed conditions like diabetes or like, potentially a heart condition, something like that, no question, you should probably at least have a clearance from your doctor saying that it's probably safe to exercise. If you're, certainly under age 50, no medical issues, you can briskly walk up a flight or two of stairs, you have no symptoms of shortness of breath or chest discomfort. It's not everybody that has to see a doctor before they start exercising, but I think as we get older, as we have other kind of complicating conditions that we're dealing with, certainly it would be prudent at least to start with to have an exam by your doctor.
I have a patient who died suddenly at 49, 48, something like that, and it was right after going on the treadmill just about as hard as he could go. He went to the maximum. He was using his heart rate as his indicator, not the indicator of I'm really tired. He was trying to get that heart rate to that number. He had a number he was driven. And he drove himself like that and then went up to bed, laid down, said to his wife, I'm not feeling very good, and then cardiac arrest. Probably a small vessel closed off and then the dysrhythmia, and there he was gone. And it's interesting, following that, his father pushed AEDs, external automatic defibrillators for our police force, and brought the first one into our police force, and subsequently it just snowballed, and all of them have the AEDs in their cars now. But the whole story of doing it too much is on the back of my brain. We've got to also know not to overdo it. And so if a person's feeling something's wrong, stop. If you're having chest pain or pressure that's going up into your neck and down your arm, hello, talk to your doctor. Karla, you're a pathologist. You deal with a lot of dead people. I mean, you do a lot of other things, but you deal with the dead people. What's your comment? What's your response to that?
Well, certainly we know that their heart disease, atherosclerosis is prevalent in our society. And so, I would be concerned about the person who doesn't recognize that they have that disease, maybe would need to pay more attention to family history and their symptoms for themselves. And so I was interested to hear what Matt said about who needs the medical clearance. Not that that's going to be any guarantee, but certainly it should be a consideration.
A warning. Well, and I like the idea of, and he says under 50, probably fine, except that you've got to hear yourself. Listen to your body. I think people don't listen to their body. A lot of heart attacks occur, guys going out and shoveling snow. They've been a couch potato all their life. 25% of the population not doing one thing. And then he goes out like a hero and starts shoveling the walk and keels over because he doesn't stop. He doesn't feel like, oh, I'm short of breath. He says, I should be able to do this, and pushes through it. Comment.
Yeah, I would agree. I think if you're just looking at, what do I have to do to stay healthy? How much exercise is that? It's probably that 20 to 30 minutes. We shoot for 30 minutes a day. It's not running a marathon. It's not 40, 50, 60 miles of running a week. It's not those numbers. It's really just simple things, and you can get to 30 minutes a day fairly easily with some of the things we've talked about.
Sure. Right. Just start with the time, not the distance. Just 30 minutes of gentle walking that you can tolerate and you're comfortable at. And I don't think you have to be afraid to do that. And listen to your body. What are the disadvantages of exercise? Do you cause arthritis to progress if you're exercising?
I think that's a little bit debatable. You sort of have to look at it. If you'd been maintaining a healthy exercise regimen your whole life, there's probably some studies to suggest you're a little less likely to get some, say, knee arthritis or something like that. I think certainly people that have a knee that's been damaged or have bad arthritis, if they push too hard, they could do more damage to their knees. But I don't think the exercising in and of itself is, in most cases, going to cause arthritis.
Right, and people who have active, hot, inflamed rheumatoid arthritis, for example, can be destructive if they push through it. So we're not saying that either.
Right, and I don't think there, again, it's necessarily the exercise. I think you need to address the underlying disease. And in most cases, I think if you talk to rheumatologists, they'll say they would like to see their patients more active. They just have to figure out the right treatment regimen that keeps them active.
Right. I had a lady whose knee is so bad that she can't walk today, and she said, I'm getting weaker because I'm not walking. I got to fix that knee, except that I don't want to because I'm not ready. I just had another surgery, and I'm afraid to walk on it because it hurts. And my answer to her is, she's got to get moving on it to keep the muscles strong in that leg so that when she has the surgery, she'll have muscles to attach.
And that's something like what Dr. Murphy mentioned, where it's maybe a water exercise where you offload the joint and you still stay active. So.
Water is unfortunately not available to a lot of people.
At least for many months of the year.
Yeah, so that's true. Well, after this, Our society tends to look to a wonder drug to solve our health problems. Most of those magic bullets never hit the target. However, as we grow older, there is one prescription that can help improve our quality of life.
First, what has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, you know, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Postmenopausal woman who had 4 hours a week of the treatment had a 41% reduction in the risk of hip fracture. It reduced anxiety by 48% in a big meta-analysis. Patients suffering from depression, 30% were relieved with low dose, and that bumped to 47% as we increased the dose. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course the kind of outcome of choice, or my favorite outcome, is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23.5 hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, you know, this varies obviously, but you know, couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I've described. In what's called the Aerobic Center Longitudinal Study, which followed over 50,000 men and women over time. And along the left side of this graph is something called attributable fractions, which is a kind of fancy word, but it's the estimate of the number of deaths in a population that would have been avoided if that specific risk factor had been erased. So for example, turning a smoker into a non-smoker, or a couch potato into a daily walker. And along the bottom is the typical risk factors. You can see the hypertension is incredibly important, and so on and so forth. But the one that was that kind of applied the most risk was this sort of mysterious CRF, which is cardiorespiratory fitness, which is really low fitness. So low fitness was the strongest predictor of death. And this is important. That most of the trials we see, to be honest, are funded by pharma or other companies because they've got a drug for hypertension or high cholesterol or diabetes, and we rarely see fitness thrown into the mix. And so it's nice to see a trial that's not so siloed. What he found was, you know, sort of two things. One is obesity and no exercise. That's a very bad combination, and that's where we saw many of the negative consequences of obesity from a health point of view. But if the obese person was active, even if they didn't have the weight loss but were just active and obese, that was much, much better, and that the exercise ameliorated much of the negative consequences of obesity. So if exercise is a medicine, what's the dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that you know, the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that the return is more granular. So if we took the Nurses' Health Study, women who went from 0 activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. higher intensity. It looks like it's equivalent to less time with lower intensity. But I think obviously the clinical pearl is mostly thinking about your style and habits and your personal cues. So if you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. So I'm just going to leave you with, I guess, two quotes. So one is Jerry Garcia, the singer who is the lead singer for the Grateful Dead. And he said, somebody has to do something. It's incredibly pathetic that has to be us. And I think that's true, that in some ways it has to be us. As Hippocrates said, walking is man's best medicine. And so I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23 and a half hours a day? So something to think about. Thank you very much.
Yep, we're going to have to cut that down to 23 and a half hours. That's all there is to it. So. Oh, I thought that was a fabulous deal. It's on the internet. You go 23 and a half and Google that, and you'll find this deal. So what was your first reaction, Karla, to that video?
It's a little bit hard to refuse a half hour a day. Spend 23 and a half hours in a sitting or reclined position, half an hour. It's got to be possible.
It's so powerfully helpful to you.
Yes.
Yeah.
It's interesting, they think they hit on all the highlights we've sort of been talking about, exactly. But the one that came up in that video that I sometimes hear from patients is I'm tired. I can't exercise because I'm tired, and it's hard to convince them that, boy, if you could get out there and do a little bit, you'd be surprised at how much better you're sleeping, and all of a sudden you're doing more and you're less tired. It's kind of counterintuitive.
I think that the most common symptom of poor conditioning is tiredness. They come to me and they say, I am so tired and weak. Well, how much are you doing? Can't do any. And the problem is it's only going to get worse. You're only going to get more tired if you do less. It's that energy that comes with exercise. It's just an amazing thing. I agree. That's it. That's the nail of it. The other issue I thought was really powerful was obesity. And I've read this multiple times, the studies look at people who are obese. We really don't have much we can do for obesity. I mean, the study after study shows that you can get a third of them to lose weight best you can, and after a year, a third have kept it off, and after 5 years, they're all back to the same weight. People seem to be the weight that they get. What matters is that they're in condition. So if we can get everybody to not say, oh, I've got to be thin. No. You've got to be conditioned. And it's that walking that's the key. So the dog.
Perfect.
Do you have a dog?
Man's best friend. I do. And so, my pattern was 5 days a week, go to the gym. Wednesday morning, I got a commitment at work. And it would conflict with the time the gym opens. And so Wednesday is the morning that I walk. I mean, it's still the same 45 minutes, but it's my little short-legged buddy Dexter and me out there, rain or shine. And so it really is, and it's beneficial to both of us.
Yeah, whatever that motivator is. Maybe it's going for a walk with a friend, maybe it's that partner at the gym, maybe it's the dog, maybe it's a little pedometer that you wear, that you set that goal of 10,000 steps today, and that's the goal you're going to shoot for. And so anything that can, whether it's a gimmick or not, anything that can keep you motivated, I think, is all the better.
One of the things I've discovered is I for years jogged with buddies. If it wasn't the banker friend that I had, it was the electronic sales guy friend of mine, or it was the researcher guy at the college, or and it's evolved. But if I depended on them to run, I wouldn't run. I mean, you got to be willing to run by yourself. And the best way to do that, I think, is just slap on a pair of earphones and listen to music or the radio. Do you use the radio when you're running?
I don't, and I never have, and it's just not something I need to motivate myself. But I think you really do have to find something you enjoy, and it can't be if running isn't something you enjoy, it's not something you're going to keep doing.
Yeah.
Now, you got to give things a chance. It may not feel great the first time out, but really just find something you enjoy to stay active, and that's what you're going to stick with.
Is there data on how long it takes before a habit gets kicked in?
Well, I mean, I've always heard that 3 weeks, 21 days, and it becomes a habit if you do it every day.
Single day. I've heard to really solidify it's 3 months. I don't know, but it might have been, those are, I don't know, scientifically proven.
Sure, I don't know.
Yeah.
You know, I think the other thing is that if we're going to learn to drive a car, we don't just get into the car, stick the keys in the ignition and go. We learn from someone else. We learn from a parent, from a friend, or we get, you know, or we go to an instructor. And I think that we may not be born any longer knowing how to exercise. I mean, walking is pretty easy, but some of these other things we're talking about, there are people in almost every community who either teach physical education or who work as athletic trainers or have some kind of expertise. And I think everyone in every community or every part of your listening area has access to somebody that can give them advice and teach them how to do something new, and if what they're doing doesn't work, maybe try something new.
I think it's especially important to those people that have some of those complicating factors we talked about. How is it with my bad knee? I can't exercise properly. That's especially, I think, when it's helpful that you get someone that knows how to exercise properly. Otherwise, I'm really the philosophy of keep it simple. You know, the more simple it can be, the easier it's going to be to stick with it.
You know, and there's a lot of people out there on a ranch, out in the middle of barren country, you know, or not close to other people, or not close to a gym, or not close to a thing. And it's winter in South Dakota, and they can easily say, I can't do it. But you know, you can put a treadmill in that room, or you can, in the living room, you can put a bike in there. You can, through the winter, do that. So many people take the winter off, and then they're out of it. I beg people, don't let the winter stop you. And I mean, I like exercising outside. I run through the winter unless the temperature's below 0, at which time things start to freeze, important parts of your body. So I've learned even covering those parts as hard as you can, it gets very cold. So I generally go right through the winter.
And even without equipment, even without the treadmill or something else complicated, we can use our televisions and our DVD players to play exercise videos that can be as simple as walking, moving your arms a bit. I mean, there are, Walmart has, or Kmart or Target, they have an immense
choice of
those kinds of that just involve you and your 2 feet, but if you need the motivation of an instructor, you can get one, a pre-recorded one, and play it every morning for your 30 minutes.
Libraries would have those as well.
Perfect.
Yep. I know of a guy who lost 50 pounds. He was a high school kid who lost 50 pounds doing this dance competition thing. Have you ever tried to compete with your children on those dance things? You know what I'm talking about? That may be out of vogue right now. But then there's the Wii exerciser. I mean, there's things that you can do. I know Satish Saxena, an internist friend of mine that is now retired, he walks the steps. He takes the steps, summer, winter, doesn't. He goes 30 minutes up the steps, 30 minutes doing this other thing. He does an hour plus of exercise every single day as I think he says prayers, actually. I think it's a meditative time for him. And so, I mean, there's no excuse. We have no good excuse, do we? What about the patients that we have in our office, Matt? I struggle to motivate people. I can tell them these facts. I can tell them scary stories. How do you get someone to actually start exercising?
Boy, it's a good question. It isn't easy. Again, I kind of come back to that. Maybe talk to them a little bit about what their barriers or what their perceived barriers are right now. That may help me kind of tackle a few of those right there in the office. And then try to get them to make a commitment before they leave. If it's going from nothing, can they do 10 minutes a day? Can they do 15 minutes a day? I've tried writing prescriptions for exercise just so they could carry something out the door with them, and it doesn't always help, but it may catch a few people. But I think if you can try and look into what are some of those barriers for them and see if you can get them to make a commitment to at least something before they leave that day.
So one of the things that I often think about is that people out there listening to this might be able to talk to a friend and bring them into the fold. Let's, you and me, buddy, let's, instead of just having coffee every morning at 9, let's walk together to coffee and walk home. Mm-hmm. I would love to do what I could to encourage people to do a mile a day. So that they don't get to the point where they can't do the mile a day. And so I offer a challenge. I'd like to have anybody out there say, I would like to do a mile a day. And see if they can start in their own community the mile a day challenge. Start at May 1st. Or April 1st, okay? April 1st is April Fool's Day. We're going to start on April 1st. Everybody throw in $20, and we're going to walk 6 days a week together, 12 blocks, 6 blocks downtown and home again, or drive to 6 blocks away from the coffee shop and then walk, or whatever it might be. I think that it's so important. And my comment is that physicians too much write the pen and prescribe a pill. Let's talk about lipid-lowering drugs for a minute. What is the value of a lipid-lowering drug versus the value of that walking?
It's really hard to quantify those things. There's an association with more exercise is better. Like you said, it's always easier to prescribe a pill, or from a patient standpoint, to take a pill for something than to make a lifestyle change. Hard for me to quantify exactly what the difference is. I know a lifelong good routine of exercise is going to do more than any medication could, and with a lot fewer side effects.
Boy, say that again. A lifelong of exercise is going to do way more than any pills, and with a lot, not to say that pills aren't needed sometimes, but better than any pills and a lot fewer side effects. I would echo the issue of diabetes, comments about diabetes and the metabolic syndrome. What is the metabolic syndrome?
Well, if one is overweight, they have more fat, and that fat produces compounds that can affect their ability to use the sugars that they take in their diet. So generally, I think of someone with a metabolic syndrome as being someone who is overweight, and I'm not sure if there are other particular factors.
Yeah. Usually there's cholesterol issues. High blood pressure can be thrown in, but it is one of those things where, boy, even exercising and maybe watching a little bit in the diet side of things, getting down 10, 15, 20 pounds, there are really a lot of people who could be off medication and not even really have to carry that diagnosis. They'll be predisposed to it again, but they could really literally get off medication if they could just implement some of these lifestyle changes and just drop down maybe 10 or 15 or 20 pounds. It makes a world of difference.
Depression. There's another condition that people treat very quickly with a medication. What's your response on starting with an exercise program?
Boy, it depends. I think if someone's predisposed to being down and you can get that into their routine, maybe every winter they sort of by the end of winter are getting down, I think exercise is a good preventive. If someone came into me frankly depressed, I do a scale, maybe I talk with them, and to rely on exercise to get them out of a true depression, I hesitate to maybe treat them with just exercise. I may try a medication, but I might say, we know you're going to be predisposed to maybe having another episode of this down the road. We're going to get you out of this, you're going to get feeling better, but let's see what we can do to maybe prevent it from happening again.
Right. always. I mean, and I treat a lot of people with depression with medications, or maybe anger with medications, but I always add the exercise in there because it augments it if it doesn't do it alone, you know what I mean? Yeah. Karla, final comment about depression?
Well, I can't speak to treating depression, but I do know that exercise makes you feel good, and that's got to be very valuable.
All right. Well, we'll be back right after this.
Chug-a-lug, chug-a-lug. I make you wanna holler, hidey-ho. Chug-a-lug.
Getting checked for colon cancer ain't all that tough. A simple stool test may be all you need, but even drinking all that stuff for a colonoscopy is nothing when the odds of getting the second most deadly cancer is 1 in 20. An easy at-home fit test or colonoscopy. Get screened, South Dakota.
Well, I bet I hear it once a week. It's hell to grow old. Of course, growing old is something we all will do, unless we die first. Alas, the future can look quite sad and depressing, especially if you think about the flab, falls, pain, blues, anxiety, thin bones, loss of libido, weakness, and memory loss that can come with aging. But wait! Listen to the exciting news. Just out there's a powerful potion that can prevent the aging process. That's right, guaranteed to slow aging. Researchers have observed how shortly after starting this terrific tonic, flab turns to muscle, falls are reduced, chronic pain and fibromyalgia seem magically lessened, depression and anxiety disappears, bones are actually strengthened, sexual function is enhanced and recharged, people experience new strength, energy, and power, and most important, memory is clearly improved. What's more, this special medication has also been shown to reduce diabetes, heart attack, stroke, and breast or colon cancer. And that's not all. If you take advantage of this fabulous offer today, it will improve your appearance within weeks. Sounds too good to be true? It's scientifically proven beyond a shadow of a doubt, and no other treatment plan comes even close. Nothing. You would expect the price for this magnificent medication that brings about all these benefits to be more than the sum of 1/3 of your income, or at least many thousands, if not millions of dollars. But no, this medicine is equally available to the rich and poor alike, requiring only an extra effort on your part. You could expect to work lots of extra hours each day to achieve these wonderful benefits, but no, you don't have to work an extra 2 hours at the beginning or end of your workday. You don't have to work even 1 extra hour. Starting today, we have a special opportunity for spending only an extra half hour every day walking 12 blocks. Yes, that's right, just 12 blocks, or whatever distance you can make in 30 minutes. You will receive most of the benefits I mentioned earlier. That's right, only a half hour. But wait, this offer only lasts for a short time. The longer you delay, the less you will get. If you start today, the benefits begin sooner and last longer. That's right, guaranteed to slow aging. Exercise is the bargain of a lifetime. Pretty bad. I'm sorry. I tried it out on my daughter, and she cringed. You know that guy who used to shout. He died. Used to shout. I don't think he exercised. Used to shout the advertisements, and you go, "This is awful," but it seemed to work. Yeah. I don't know. So, well, we've said a lot of things. We've got just a minute, 1 minute, I think, to summarize. Karla, take home. 30 seconds.
Exercise makes me feel good, and I think everybody should take advantage of all of the advantages of exercise that you mentioned, Rick.
But the biggest one is you feel good.
Yes.
There you go. Matt.
Well, I think just comes down to making it part of your life. It has to become a habit, and once you get into it, you'll never look back.
Well, that's great words, and I thank you both for your volunteer effort to be here tonight and to give of yourself and lay out your heart and soul on this particular important issue. It brings us to the end of our show. I sincerely thank our studio guest, pathologist Dr. Karla Murphy from the Avera McKinnon Hospital and Physicians Laboratory, LTD, in Sioux Falls, and med-peds specialist and teacher, Dr. Matt Bean from Avera Medical Group Brookings and Sanford USD School of Medicine, for helping answer your wonderful questions from our audience. At a recent medical organization meeting, one of my fellow physicians related his advice to his patients. Don't worry about the number of days you need to exercise per week. Just remember to exercise on the days when you eat. Until next time, stay healthy out there, people.
Funding for On Call is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, Regional Health, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.